You've heard about some children that were playing basketball and all of a sudden they dropped dead. Some of them were born with abnormal heart muscles that wasn't picked up with a chest x-ray and an EKG.
Hello, this is Francisca here again, your co-host, and we're talking about chest pain in children, when to be concerned, the causes, symptoms, and everything about it. So,
thank you, Francisca. Now, chest pain in children is something we see a lot of. Many times, children will have had a cold for a few days, and when they cough, they say, "Ooh, my chest hurts anytime I cough." Now, that is one common complaint that we get. So when children have had a cough, especially if they've had a fever and they're complaining about chest pain, we usually like to ask them, where is your chest pain? What part of your chest hurts? Now, if they say their chest is hurting here, that is common. And that's one thing we call costochondritis. And what does costochondritis mean? A lot of children have cartilage that you have your ribs, and then you have the cartilage and the sternum. The sternum is, there's a lot of cartilage in the costochondrial junction. Basically, it's a junction where the ribs meet the sternum. And anytime a child has a cough, it stretches the cartilage in that sternum and it causes inflammation. And that's why they will have pain in the chest when they cough. So if it's only with coughing, then we say, hey, take ibuprofen because your child has costochondritis, which is related to the cough. Now, some children might have, they just tell you, I started with a cough yesterday and my chest hurts. Where does it hurt? Here, or here, or here. Then we do chest x-ray. There's a pneumonia sitting right there because infection hurts. And that's different because they're not complaining about chest pain here. They're complaining about chest pain in other places. So you do a chest x-ray, most times they'll have a pneumonia. Maybe not most times, or many times they'll have a pneumonia. Most other times it might just be because their chest is inflamed or the rib cage or the muscles in between the ribs are hurting from them being sick. Then the chest x-ray will be normal. The other reason we see chest pain a lot is left-sided chest pain. And the child will tell you, my heart is beating very fast and my chest hurts. And where is the heart? The heart is on the left side. Anytime we have a child coming in with left-sided chest pain, especially an athlete, we need to do two things. We do a chest x-ray to make sure that the heart isn't big. The second thing, we do an EKG, which is the tracing of the heart. If the tracing of the heart is abnormal, then we have to send them to our dear friends, the cardiologists. The cardiologist will go ahead and do more tests. But if the chest x-ray and EKG are normal, most times it's usually just irritation of the chest wall from the heart beating and sometimes just irritating the chest wall from palpitations. If that child is an anxious child or there's a lot of anxiety going on, we have them follow up with us and we check on a more frequent basis to make sure that that chest pain is getting better and the child is doing good. Now, in some cases, we might have a child who comes in with left-sided chest pain. Chest x-ray is normal. EKG, which is the tracing of the heart, is normal. We still send that child to cardiology, especially if the child is an athlete, because the cardiologist might go ahead and do further tests, like a stress test, because if there's an abnormal if there's a structural abnormality in the heart, meaning the child was born with a muscle that is too big, like this cardiotrophic, there's some conditions where part of the heart is bigger than it should be. We might not pick it up on EKG and chest x-ray, but the cardiologist will pick it up, especially if the child is having persistent chest pain that doesn't go away, and they're having the chest pain mainly with exercise. You've heard about some children that were playing basketball and all of a sudden they dropped dead. Some of them were born with abnormal heart muscles that wasn't picked up with a chest x-ray and an EKG. So if a child is an athlete and is having chest pain when they are running or when they are playing any kind of activity, they need to stop that activity that they're doing, and you need to take them to see the cardiologist or see your pediatrician and let them do a referral to cardiology. They cannot do any kind of physical activity until the cardiology checks them out properly. They will need an ultrasound, which is a heart echo, and they will also need to have like a stress test to see what exactly is going on. In severe cases or in cases where there's a high suspicion of an abnormality, they might need to scan like MRI of the heart with where they check and see if the blood flow of the heart is okay and to make sure that there's no abnormality in the heart muscles. And those are children that are usually doing a lot of activity and they're having chest pain that is not going away. You don't want to joke with that. That is a red flag and it needs to be taken care of. Now, the other thing we see a lot of is, oh, I have chest pain here. And then the child would tell you, ask them, when was the last time you pooped? Oh, about a week ago.
Oh.
When children are constipated, they can have what we call heartburn. And heartburn means if they are not eating and pooping regularly, the gastric acid, kind of like a sink that is blocked, you're trying to pour water down the sink and it's not going down. If a child has too much poop in their system, they might end up having reflux or heartburn, where the gastric acid comes back up and then they start to feel like chest pain in the mid-sternum. And most times they don't have a cough, they don't have a cold. Those children need to be on Miralax or any of your constipation medicine. They need to eat more fruits, more vegetables. They might need an enema to loosen the stool from the bottom. And they usually will need to be on an antacid that will help to decrease the amount of gastric acid so that even when it goes back up, the acid is not acidic as such anymore. And a lot of H2 blockers, you have your omeprazole, and yes, all those medicines that they use for reflux or heartburn, that will neutralize the acidity so that even if the gastric acid is coming up, it's not causing heartburn and symptoms. And most of those children, once they start eating more fruits, back to lifestyle changes. More fruits, more vegetables, doing exercise, pooping every day, drinking their water. When they do all that, then all that becomes history and they don't have any more problems with heartburn or reflux.
Is there any relationship between anxiety and chest pain?
Yes. Chest pain is actually one of the psychosomatic symptoms when children have stress, for instance. They'll complain about certain things. Oh, my stomach hurts. Or I have a headache. Or my chest hurts. And a lot of that has to do with anxiety. When children are in a highly stressful situation, some children might just faint. And you'll be like, oh, what's going on? And then we do EKG, we check their blood, everything is normal. When children are highly stressed, it can cause them to be to have palpitations, and they can end up with chest pain. They might end up not eating and end up with heartburn because they haven't eaten and they're stressing out. They might end up with diarrhea. And some children might even want to throw up just because they are so uncomfortable with where they are. So those children, apart from treating the symptoms that they have, they might need to see a psychologist or psychiatrist just to help take them through the stressful periods of their life. And with mental health, because of all the stress that COVID brought, with us being on lockdown, a lot of children being at home, parents having psychiatric issues, transmitting it to the children, or children just even losing loved ones during the COVID pandemic and feeling uncared for, or just a lot of stress in the society. We recommend, if there's any kind of mental health question or concern that you might have for your child, seek a specialist, seek a psychologist, a psychiatrist, a behavioral analyst to analyze your child's situation so that your child can get the care that they need. Very, very important. And then with chest pain, most chest pain in children is not cardiac, because you don't really hear of children having a heart attack and dying. But for the children that we talked about, that are athletes or that just keep complaining about chest pain, they need a thorough evaluation with cardiology. The heartburn patient needs to be treated with the GI medicines that we talked about. And then if your child has a cold, just give them, ibuprofen for the chest pain. The other thing is there's some children that they can have chest wall pain from certain infections like influenza. We don't see a lot of influenza here, but some children will tell you everything hurts, my head, but my chest hurts.
Whooping cough too?
With whooping cough, they can have chest pain from the cough going, they go, and the reason they have that is because they're trying to increase the alveoli or the lower airways so that they can exchange oxygen. And that's what whooping cough does to the body. And that's why it's called whooping cough, because there's a hoop with the cough. So children with whooping cough, they can cough so much that their chest hurts. And most times, once you make the diagnosis, that's what it is. Whooping cough is a bacteria. It usually is taken care of with antibiotics. And most children will get better with time. But there's a vaccine for that. So children shouldn't be having whooping cough right now. I wasn't immunized and I had whooping cough in the hospital for 2 weeks and almost died. But by the grace of God, I'm still here.
Yes, you're here.
So at the end of the day, get you immunized, get your vaccines. And parents, make sure your children are immunized. So we will not be talking about whooping cough. And at the end of the day, chest pain, if your child is complaining a lot, especially if it's any of these things, see your doctor, make sure it's nothing bad. The worst that can happen is a child might have a congenital cardiac abnormality that wasn't picked up and be having chest pain, cardiology is always recommended in that case. And most times the child will have other symptoms like they're not eating, they're not growing, and they're small for age and they just don't look right. And there's another thing that can cause chest pain. I had a child who came in, he had been playing tennis, and he was playing tennis. He was 16, 17 years old, a skinny boy, tall with glasses. And he said, oh, my chest hurts. So we just did a chest x-ray. And he had a pneumothorax. Basically, his lung had collapsed because he had an injury. The air seeped out of his lungs and collapsed his lungs. And now his right side was full of air and there was no lung there. The lung was tiny right here. So it was an emergency because they had to decompress that lung so that the child could breathe. And he was just talking and saying, hey, yeah, doctor, and really chatting. And we're looking at him like, you're still alive and your lung is all collapsed. His lung was down like this, down here in the chest x-ray, air all over. Those are unusual. That's what we call essential pneumothorax. And that can happen from trauma. If you've been in an accident and your chest is hurting, you need a chest x-ray because you might have one of those. That child had to be admitted to the ICU for a chest tube. And usually it's the cardiac surgeons that will place, the cardiothoracic surgeons that will place the chest tube, or the ICU doctors. They know what to do. So chest pain, especially if you've been in an accident or you've had some kind of trauma, whether you were playing tennis and you felt like this patient I'm talking about, have it checked out so you can get the best care that you need.
And that brings us to the end of chest pain in children. So don't forget to subscribe to our YouTube channel and follow us on our social media page at Pediatrics _to_go. So until next time, bye.